You are now listening to Tackling the World, a podcast designed to bridge the political divide by bringing people together to discuss important topics affecting our daily lives. Today, we discuss our topic, the world and COVID-19, a very important topic to discuss because of the massive effects world leaders will have with their next decisions. Our guest is Lap Nguyen, a senior in high school with left-leaning views. He will be sharing his perspectives on the world and COVID-19.
Hello.
Hey Lap, how's it going?
Oh, it's going well. Thank you for inviting me on.
Of course, anytime. I know you're a great person with lots of great political views, and you're very knowledgeable about what's going on all the time. So it's really great for me to have you on here and talk about the world and COVID-19. So thank you.
Oh, thank you. The pleasure is mine.
All right, then. Are you ready to jump into the questions?
Sure.
All right, let's get started. So to start off, we're going to start with just the United States, just so we get some information off the ground from here, and then we'll move on to the world. So do you think the United States is doing enough right now to fight COVID-19?
I think that the United States is definitely not doing enough right now, especially in terms of two regards. The first is the cavalier nature about of which our leaders seem to be taken towards this whole crisis, and the second
Mm-hmm.
is that we are far from reaching the testing capabilities that are required to have safe reopening of the country. And so I think that right now the United States is doing barely enough. We're just barely having the necessary medical supplies, and we're just taking a very kind of hands-off approach to this whole crisis. And it seems to me that the mentality is, this is a crisis, we just pump money into it rather than finding actual solutions or listening to the medical professionals who are telling us that we need to stay at home for at least a few more weeks, or we need to expand our testing, because we can clearly see that testing right now is not enough, especially when in regards to our partnering nations such as Iceland or South Korea, where they were able to expand their testing capabilities and was able to slow down the disease pretty significantly.
Mm-hmm. And you were talking about how we were far from our testing capabilities. What do you think when you see President Trump in his press conferences saying that the United States is the country with the most tests done right now? What goes through your mind when you hear President Trump say that?
Well, I think it's I'm not surprised, quite honestly, because that is the language that is used by our current administration. And
Mm-hmm.
unfortunately, I think it really is a dangerous kind of language to use, because it assumes that, and it implies that we are actually doing better than we actually are. And so in
Mm-hmm.
return, what happens is his supporters and the people who listen to his words, they believe that we are actually, reaching a point where we are able to open up and everything be safe again. And that's dangerous. And we can see that cases are now beginning to spike in certain areas where people are not obeying stay-at-home orders. And so I think that it is dangerous, but I think it's nothing out of the ordinary, that's for sure.
Mm-hmm. And, President Trump is a Republican. He's a conservative, and their ideology is pretty different, obviously. And
Hmm.
they want states to have their own power to do what they want to do for their citizens, right? They
Yeah.
want states to have more power. Do you think at this pandemic stage that President Trump should leave states to do what's best for their people? Or should he, with the federal government, step in and take charge to push the whole country in one direction?
I think that the federal government has a duty and a responsibility to at least establish some parameters, that certain states cannot relax their restrictions too far. But at the same time, the requirements and the necessary steps to alleviating the pandemic differs from state to state. We have very densely populated California and New York, where there is a necessity to continue the ongoing restrictions, whereas states such as Wyoming or West Virginia, where the population is at least a bit more spread out, we can have some relaxation of policies to ease the concerns of local citizens. So I think that it would be wise for President Trump to at least allocate some of that responsibilities to the local governors, but also be reminded that with national health guidelines, there are precautions that should not be lifted too early. So, for example, certain states may relax their stay-at-home orders, but social distancing guidelines must continue for all 50 states because right
Hmm.
now we're in such an early stage in the pandemic where it could go either way. And so I think that it would be smart for President Trump to at least establish some sort of basic guidelines.
Now, there is a lot of speculation about the economy, which is currently tanking. I mean, obviously, all over the world. And, many people, Democrats and Republican politicians on either side, are both very worried about jobs and the increase in unemployment. So, do you think that they should not be thinking about the economic impacts this early in the pandemic? Or do you think they should be really worrying about it right now before it escalates into something bigger?
Well, uh, I think I think they are at least on the right track in terms of paying attention to the economy. But I think it would be short-sighted to just focus on the economic impacts of this pandemic and in return take actions that would cause an explosion and possibly a second wave of infections, like reopening too early. So I think that, yes, it is good that the federal government understands the impact that this pandemic has on the citizens. But it is also crucial to understand that if we reopen too early, uh, the economic impacts of this pandemic would be exacerbated because this is just simply the first wave. And if we reopen too early, as China have seen, there's now a second wave spreading through Wuhan. We can actually
Hmm.
face that very same debacle, and in turn, the economic toll would be much greater and much more prolonged. So I think it is good that they're paying attention, but they also have to take into consideration that if we are not careful, this can go on for much longer than anyone hopes it would.
Now, what would you say to all of the protesters out there around the country who are asking to get back to their jobs and to earn money?
Well, I think well, two things. The first is that I feel you. Both of my parents, at least, were unemployed, and now my dad is an essential worker who
Hmm.
delivers parcels, and my mom really do want to kind of return to work and make a living. But the thing is, the economic impact is hurting everyone. It is not just you that are being hurt. And so I think they should at least understand that this action isn't meant to curtail their civil liberties or any of that sort, but rather as a caution for their family and themselves and the safety of their community. And so I think that that's really important to really to the that the protesters understand. Additionally,
Hmm.
many of these protesters, they're going out there and they're saying that they're the real patriots of this country fighting for liberty and freedom. Well, I would argue that by protecting their community and by not allowing more Americans to die needlessly because of relaxation of social distancing norms, that's being a real patriot. And so I think it's not being out there and proudly waving the American flag that is patriotism, but it's the care and concern that people have for one another as Americans, and the empathy that we feel for each other during this pandemic. That's what makes us patriots.
Now, these protesters, their biggest problems are with money, right? Without jobs, they don't have
Hmm.
money, and they can't pay rent, they can't pay for food, and they can't pay for insurance, like car insurance or health insurance. I mean, there's so many things that, a working person needs to pay for every single month. And $1,200 every once in 3-4 months is not going to cut
Hmm.
it for them, right? I mean, $1,200
Right.
goes by extremely quick. So,
Correct.
so don't you see? I mean, I guess, I
Right.
see the point
I
where
see your
uh-huh,
point. No, I absolutely do. And I think that that is where the federal government can really come in and play the role that it should, right? Because
uh-huh,
what we have continually see in this country, whether it be, Democrats in charge or Republicans in charge, is that when it comes to economic crisis, the bailouts always goes to the largest corporations and the big banks, not fully to the American citizens. So I think that there is an inherent responsibility of the federal government to, at least during this time of crisis, help out the common folk and the people in need. And so I think an expanded program of both an expanded unemployment program, right, would be extremely beneficial during this time, and not just pumping money into the airline industry to keep them afloat during this pandemic, because real Americans are suffering. So I think that that's where it comes in. And so, some of these protesters, they were formerly very against kind of the idea of a federal government taking on that role, but this crisis has highlighted the importance of having some kind of safety net in place, and the only entity that is truly capable of doing it in a time of crisis is the federal government.
and do you think the recent $3 trillion stimulus package is doing enough?
Well, I think the $3 trillion stimulus package that you're referring to is the
Mm-hmm.
proposal made by the House Democrats, and
Yes.
is currently, I think, would be the correct step, would be the right step in. Be the first step in the right direction there. I think that we need to expand those programs, so that, Americans can stay home with the knowledge that they will have the money to put food on the table. And so I support that $3 trillion kind of stimulus package, because that's what Americans needs right now. And so yes, I do support it, but I unfortunately think it's going to die in the Senate because of political reasons.
Yeah, and it barely passed the House. So I mean,
Right.
there's a lot going on there. Now moving into some of the cures touted by President Trump. He suggested untested drugs to American citizens, such as the hydroxychloroquine drug. Uh, what are your thoughts on this?
Well, I think, once again, it really is. There's no better word for it. Dangerous. I think
Mm-hmm.
it's very, the callous nature of the current administration, towards touting these unproven claims in order to make themselves look good, is going to play a detrimental impact on American lives, because, Americans are going out there thinking that there is some kind of cure for this disease, when there isn't. I mean, we've recently seen that a new study have come out that hydroxychloroquine actually does not work against COVID-19, and for the people that it worked for, it really, was purely luck, and
Mm-hmm.
of a smaller sample size. And when we extrapolate that to the entire population, it clearly doesn't work. It might at best reduce certain symptoms, but in no ways makes them less contagious or even help treat their disease. And so I think to tout it like it's the miracle cure is akin to a old west snake oil salesman. And so I think,
Mm-hmm.
that is dangerous. That is dangerous.
So now moving on to the world and what countries can do together. Um, what do you think the world can do right now, together, working together, during this dire time to fight off this virus?
Well, I think the first thing is the world needs to come together to work out first a vaccine and a cure to this disease. And I think, partnerships are critical in fostering that. So it requires kind of intercontinental partnerships, as we've seen with the previous outbreak of Ebola. The world came
Mm-hmm.
together and across, I believe it was 10 nations with various clinical trials working on the same kind of vaccine. They were able to manufacture the Ebola vaccine in about 3 years time. 3 years time, and so I think that that's where we need to be headed is more global cooperations in terms of figuring out how to cure this disease and how to prevent it from spreading. And although we have certain kind of enmities, like with China right now, I think the time as of right now is not the time to blame other countries, but rather to work cooperatively to at least find the cure, find the vaccine before we worry about who is at fault for this virus.
And do you think defunding the World Health Organization is going to help this cause in any way?
I think it's not. It's a huge setback for
Mm-hmm.
for the for global medicine, because the World Health Organization is essentially coordinating kind of the or can be used, because the infrastructure is already in place and should be used to coordinate the development of new vaccines and new
Mm-hmm.
drugs. And right now, they're not being utilized at all. And in fact, after we defunded them, now we're wasting the global infrastructure that is already in place for global cooperation in terms of this regard, and essentially just having each country develop their own or working on their own thing. And I think that that's very that's a huge setback for the global community.
Are there certain things that countries are doing right now to fight COVID-19 that the world can learn from?
Yes, I think that there is definitely. I think the first lesson is testing. What we've
Mm-hmm.
seen from South Korea is testing was what allowed them to figure out and perform contact tracing to the point where they are able to effectively kind of corner the virus, quarantine those individuals, and now their cases are on the rapid decline, and they are and they can slowly get back to work and go back to normal. Another thing is enforcement. We look at Germany, and they were willing to take a hard stance. They had certain
Mm-hmm.
areas. They had fines up to 10,000 euros against citizens who would not wear face
Oh
masks.
wow.
I, these are drastic measures, but in return, Germany is now starting to open up once again, and we can see that they're doing much better in terms of not just flattening the curve, but decreasing it to the point where they're able to get back to normal with, of course, still social distancing in place. And so I
Yeah.
think it might not work too well in our kind of American society, because we really, really value individual rights. But I think this
Mm-hmm.
pandemic is where this really gets tested, and sometimes we have to put aside a little bit of our individual rights in favor of the common good, because to continue to say that it is my right to go out without a mask is being extremely selfish to the people around you and the community that you are in, because we do not live in a vacuum, unfortunately. And so people might and possibly will be hurt by your actions. And so I think that that is where the United States can really learn from, is that. And then finally is New Zealand. We look at New Zealand, and they were able to get their cases down because they had people in charge that took the disease seriously. I mean, I believe back in March they had one case. They shut down the country immediately, and
Mm-hmm.
now they are they had a couple of days where they had no COVID cases, and now there's only a few where the government can actually keep track and keep tab of the spread. And so I think that with those three countries as examples, I think the United States can learn a lot there.
And one constant here is that we see that each of the countries you just mentioned, they all started early. They started their lockdowns early, they started their testing early, and they ramped it up really
Hmm.
quickly. And I feel like the US could have done the same exact thing if it weren't for the president, not caring
Right,
about it. He's like, "Oh, when summertime comes, it's going to go away because of the heat." I mean, just saying
right,
comments like that, you're not really helping the situation. You're not doing really anything to help the country move forward with this.
right. I
And
agree.
yeah, and we could have definitely done that. And one thing that I found pretty fascinating was in China, in Wuhan, especially in that area, before they lifted the lockdown, the government actually had an app set in place. I don't know if you've heard of this, but they had an
Oh,
app by the government, and it's basically a QR code
hmm,
in the app, and it's either red, green, or yellow. So red
okay,
meaning that you have the virus and you should not be outside, and yellow being you have been in contact with someone recently who may have the virus, and green being you are free, you don't have the virus, you're good to go. And how this works is if you want to go buy groceries or if you want to go buy a train ticket or a plane ticket or whatever it may be, you have to show these to the authorities there. And depending on what color it is, you will be allowed certain access. And I know something like this isn't would not work in the U.S., especially with all the privacy things going on.
hmm,
This would basically allow the
yep,
government to track their citizens a lot more, and
right.
people won't like it here. But do you think something like this could be a little possible?
Well, I mean, is it possible? I'd say probably not here in the United States, but
Mm-hmm.
whether or not I think that this is a good idea, I honestly think that it really isn't, in my
Mm-hmm.
opinion, because it sets a dangerous kind of precedence where yes, the government is, hypothetically doing this for the common good, but at some point there is a boundary that has to be drawn. And so
Mm-hmm.
to have an app like that really inhibits kind of data privacy, and that's dangerous, I think, in the long run, and would be detrimental to our individual rights. Now, with that
Mm-hmm.
said, I think there is definitely something to be said about, keeping, at least figuring out, which individuals should stay home, and that really goes back to testing, because what we've seen is, in terms of places like South Korea or Germany, they were able to get the tests in place, and was able to tell certain citizens that they should stay home, and have the
Mm-hmm.
fines in place to encourage that. And so I think that an app like that here in the United States would be particularly dangerous. And if we look at to our neighboring countries, um, I think, they were able to mostly resolve the situation without resorting to such drastic measures. Now, if we have an app where it tells its users, like, here's like a checklist of whether or not you should go get tested, I would support that, because then it would
Uh-huh.
raise awareness about the disease and what the symptoms entail, and that's really important, is awareness in the situation. And so I
Yep.
think, yes, I would support an app like that, but in terms of tracking, no, I would not.
So now moving to frontline workers in all countries.
Hmm.
What can what can countries do to help frontline workers as they continue to put their lives at risk while saving others?
I think the first thing is, countries could choose not to actively go against the advice of medical professionals. That's I
Yep.
think the number one thing, because
Mm-hmm.
I think it really is, um it really hurts the healthcare workers, because when citizens are told that they are free to go, or they can go with these relaxed restrictions, they do things that are not in the best interest of public health, and that
Mm-hmm.
puts the lives of these men and women on the line. And so I think that that's the first thing. The second thing that's really important is we need to focus on more uh, the continual manufacturing of medical supplies, because we've seen the images in the New York hospitals where nurses are using garbage bags to protect themselves. That is
Yeah.
atrocious for a country that claims to that is the wealthiest nation on earth. And so I think that, that's just in the United States. But in other countries, testing supplies are also running low as well, depending on which countries you look at. And so just continuing that supplies is also really important. And then finally, mental health is really important during a time like this. And we've seen, unfortunately, many medical professionals, at least one very notable one that made it to the New York Times, where
Mm-hmm.
she essentially committed suicide. And I think that this needs to
Mm-hmm.
be addressed, because we are, watching our medical professionals being really overworked, and they are overwhelmed. And so there has to be some kind of counseling in place, mental health resources in place to help these people who are so bravely putting themselves on the front lines of this pandemic.
Yes, and for everybody who's listening, a way that all of you can help our frontline workers, no matter where you live, is I know for a fact that many hospitals are in dire need of face masks. Not to treat COVID-19 patients, but in order to treat regular patients, and they would love to use some homemade masks in order to make that possible. And I know my parents have been, or my mom especially, has been using her sewing machine to make, I mean, lots and lots of masks, face masks, using like extra fabric just laying around the house. So if any of you have like extra fabric, I mean, just making 5 or 6 masks and going to your local hospital and delivering it to them could have a major impact for them, because every single face mask that you deliver really helps a lot. So for all of you out there, if you could go ahead and do that in your spare time, because I know a lot of you are just sitting at home, it could really help out our frontline workers. So just wanted to say that. And now moving on, we're going to move on to the World Health Organization and some concerns they've been raising about a
Mhm.
mysterious inflammatory disease in children potentially linked to COVID-19. What are your thoughts on this?
Well, I think that that's just that just highlights how much we really don't know about this coronavirus, and what it's capable of. And so I think we have to continue to study its progression. We need to look at all the cases, and really take this seriously. And at least I am a bit, as a citizen, in
Mm-hmm.
some sense, I'm at least glad that here in the United States, our leaders are at least taking it just a bit more seriously than they used to. That I mean,
Yep.
that's the first step in the right direction. But like I said, this disease is highlighting how much we don't know about it, and so we need to put kind of all of our efforts and weight behind figuring out what this is, what it does, and also it really eliminates the notion that young people are not at risk, or at lower risk of dying or having serious complications from this disease, and this is somehow an
Definitely.
old person's disease, right? So I
Mm-hmm.
think that that's where we have to take it more seriously. We have to watch our children. I know I have a brother who is 9, and he touches his face like all the time. And now if you go even younger, babies, they put whatever they want into their mouths, right? So those
Exactly. Uh-huh.
those are really kind of at risk demographics now, as we're finding out. So it really brings it into light that we should be taking this more seriously, because we really don't know what's going on here.
And in so what specifically could some countries do to help prepare for this?
Well, I think for one, they should at least um, do wait, so for this, are you referring to the new kind of complications, or are you referring to
Yes,
the
yes.
disease as a whole? Oh, the new complications. Well, I
Yep,
think
the new complications.
yes. I think what they could do is they could at least, broadcast it and bring it to light. Have public officials and public health officials highlight the severity that it has in certain children, and that the risk
Hmm.
is now not just for old people, but for young people as well, so that parents are aware of the risks that their children faces in terms of this disease, and they can take the necessary precautions to clean the toys, watch where their child is going,
Yep.
make sure that their child is at a safe distance if they're somehow in public. And so that's where countries can really prepare, because the best thing about this is it's better to not contract it at all than even if there's a cure at the end. So that's why it's really important that prevention is the most important factor in all of this.
So travel bubbles is a new experiment run by some countries in the Baltic states of
Hmm.
Estonia, Latvia, and Lithuania, where
Hmm.
citizens from these countries are allowed movement between them only. What are your thoughts on travel bubbles, and do you think these countries should be doing this right now, especially in the midst of a pandemic?
Well, I think that the reason why these countries are allowing some of that is, I think, for one, their population is small enough where they've probably done the adequate testing that are in place, and so their governments at least feels a bit safer in terms of that. But I think it's still a very risky move.
Mm-hmm.
But those three countries are extremely linked together, the Baltic states, in terms of economy and of yeah, and so I think it is. I'm not saying it's good, but it's it's probably risky, but it's understandable why they would feel at least safe enough where they can have that. Now, if we're looking at other countries like Western Europe with France and Germany, their populations are huge, and so having travel bubbles would be extremely dangerous,
Oh
and
yeah.
especially in densely populated city like Paris, Berlin, and London, that's
Mm-hmm.
really kind of where disease can fester. Whereas the Baltic states, they do have their densely populated capital, but most of the population is relatively suburban to rural, and so
Mm-hmm.
that's where I think that can really be in place. Now, as for the United States, we are just simply too large, and the amount of cases that are currently going on right now would make travel bubbles here in the United States just, I believe, a very dangerous concept.
Of course. So we were talking about mental health with frontline workers,
Hmm.
and the world some organizations like the World Health Organization are saying that there is a looming mental health crisis,
Hmm.
and they are telling countries to do something about it before it gets even more worrisome.
Hmm.
So, do you know any countries right now that are taking these steps? And if they aren't, why should they be taking these steps?
Hmm. Well, I think let's see. I'm not aware of countries that are not taking the necessary precautions in terms of mental health. So that's something
Mm-hmm.
I will be looking into. But I think, you know, speaking from what I know and experience here and looking at just kind of the United States as a whole, mental health has been our weak point in many regards, even before this pandemic. And and so what we're seeing is this pandemic is just exacerbating the mental health crisis that it's already going on. I mean, before this pandemic, suicide was one of the leading causes of deaths for not for Americans and also for young adults. And now
Yep.
it probably is much worse thanks to this isolation. And so I know also is that there is stigmatization in terms of mental health in Vietnam and perhaps even Asian countries as well. And so that's where I think we need to. This is just a broader kind of uh, issue, but we need to destigmatize mental health. But during this pandemic,
Hmm.
what countries can do is they can they can offer resources in terms of mental health and have clinics or have online kind of um, therapy sessions of some sorts that should be
Hmm.
available to citizens, perhaps for a discounted price, subsidized by the government, whether or not I think that would be beneficial. Definitely make it accessible to frontline workers, healthcare professionals there, and also have PSAs that encourage people to perhaps not go out, not gather, but take a walk around the neighborhood, something to
Yeah.
really allow them to get out. And I think that here in Minnesota, uh, you know, uh, the governor has encouraged people to not just just go outside and enjoy the scenery, and that's why he's also loosen up restrictions in terms of outdoor recreational areas. It's that
Hmm.
it's expansive enough where you don't necessarily gather, so practice social distancing, but also allow your brain to just kind of wander and take your mind off of the current crisis.
Definitely. And we all know that any sort of vaccine for this virus is more than a year away at the earliest. And
Hmm.
many people are suggesting that herd immunity could be a way to reduce the amount of coronavirus cases in the future. What are your thoughts on herd immunity, and do you think it's worth looking into and trying?
Well, I think everything is worth looking into and trying right now, but we also have to understand that that also means that you know people people have to. It's going to be a big sacrifice if we go into the direction of herd immunity. So you know we don't know for sure if it's going to work, because what we've seen in China at least is that this virus has the capability of reinfecting people who have already been infected, and
Mm-hmm.
so this is I don't think it's going to work in this case, because of the nature of this virus. This isn't like mumps or chicken pox or something like that, where
Mm-hmm.
once you have it, your body builds the immunity it needs. Unfortunately, the in some people they're going to get reinfected, and so herd immunity might not work at all. And what we would see is a massive explosion in cases if we go in this direction. So it is a possibility to try out, but from what I've seen and from what people are seeing from this virus is it probably won't work.
So many countries right now are in a state of fighting for survival. One
Hmm.
example would be the United States buying early access to a potential vaccine from a French drug giant, Sanofi, I believe is
Hmm.
how you pronounce it. I may have butchered that. Should the United States be behaving this way, or should the United States work with with other governments to share the access to this potential vaccine?
I think, well, here's the thing: the United States might, if it follows this path, it's a very short-sighted path, because if the United States get the rights to this vaccine, or at least have kind of access to the bulk of it, that means that other countries can still be infectious. And if the United States might get rid of itself of the coronavirus somehow, right, and we open things up, well, people from
Hmm.
other countries are still going to be traveling to us, and we will get reinfected again. And so to just focus on ourselves is detrimental, and I think it hurts our self-interest. And so by partnering with other countries and making sure that when this vaccine is available, it will be able to be cheaply distributed across kind of all nations of the world, that's that's how you get an eradication of a disease, or at least mass or mitigation of its effects. when we look at the smallpox vaccine, right? The
Mm-hmm.
reason why we no longer have smallpox, and in fact, it has been eradicated since the 70s, is that all
Yep.
nations were participating in this massive global effort to eradicate the disease. Additionally,
Mm-hmm.
we look at polio. We are now down to kind of single digits, double digits. It ranges year per year of cases, and that's because of a global effort to immunize the entire kind of global population. And by only doing so are we assured that the threat will never come back to haunt us. And so if we work in our self interest right now, it will hurt our self interest in the future.
And you were talking about, giving vaccines to their population in order to slow down, polio or smallpox or whatever it may be in the past. What do you have to say for anti-vaxxers at this very moment?
Well, um, I hope that when, you know, I pray that you never get the disease because wow, it's gonna be
It's gonna be
sad.
tough. It's gonna be rough.
Yeah,
Yeah.
because I think anti-vaxxers, they're coming from a point or perspective of you know
It's like
ignorance
fear, or yeah,
and fear,
ignorance. Yeah.
right? And
Hmm.
and to some extent, some questions are good, like wanting to ask about ingredients within vaccines, fine, but at some point, when the evidence scientifically is concluded that they are safe, I don't to continue to go against that. I think it is just simply being stubborn because
Hmm.
the scientific consensus is vaccines do not cause autisms. They do not have the adverse impacts that anti-vaxxers claim. And in fact,
Hmm.
if that is the case, like if it really is that bad, then we would have never been able to eradicate, smallpox or mitigate polio, or even in the United States until recently, eradicate measles.
Yeah.
That's simply the truth.
Hmm. And now I just want to slightly touch on a topic, but I'm planning on doing another podcast just dedicated to this. So
Hmm.
just a little talk on it. What do you So do you think the World Health Organization has had faults during this pandemic? And do you think countries should keep the organization accountable?
So two things with that. First, yes, I think the World Health Organization could have handled it better by at least exerting more pressure on China
Hmm.
during the very early stages of this pandemic. I think they were I don't know whether or not there was were interests that we do not know about that were at play there, or whatever the dynamic and relationship is. But I think that if had they had pressured China to at least release more accurate information, open up the country for the Health Organization to come in and investigate, that would have resolved and possibly mitigate the impact of this pandemic. With that
Hmm.
being said, countries, the World Health Organization is a United Nations kind of agency, right?
Hmm.
And it is there because of all the countries involved. And so if the various countries, they are what keeps they are what keep the World Health Organization accountable, and I think they should. With with that said, we're not trying to go and point fingers. That's completely unproductive. But what countries
Hmm.
can do is take the infrastructure that is in place, that is the World Health Organization, and hopefully find some kind of cure or vaccine for it. Because to just simply point fingers and blame means the squandering of a valuable kind of multinational infrastructure that is already in place. And so I think it's the responsibility of every country to, keep an eye on the World Health Organization, because the World Health Organization is composed of doctors and physicians from all the different countries of the world.
Hmm. And this is my final question for today. So we've discussed a lot and ranging from different topics.
Hmm.
If there was something that you wanted listeners to take away from our discussion today, what would that be?
Uh, I think the most important thing is to listen to the voice of professionals, of of scientists, of doctors during these times, and to
Mhm.
ignore the amount of misinformation and disinformation that are going around in this country. Because ultimately, whether or not we tackle this pandemic is truly up to us. It really is down to each one of us being cautious, being knowledgeable,
Mhm.
and being willing to put our community first before ourselves.
And thank you so much, Lap. And before
Yeah,
we close off
thank
today,
you.
I just want to thank you, Lap, for coming onto the show and having a productive conversation with me on the world and COVID-19. It was really nice to hear your perspective, and I'm sure a lot of people here listening learned something new.
Thank you.
And finally, I would just like to thank all of you listeners for taking time out of your day to listen and help bridge the political divide. Our next podcast will be next Monday, the 25th of May, so be sure to tune in for another awesome guest and great discussion. Until then, thank you, and I'll see you all next week.